Are you a nurse and have ever wondered why you leave the job feeling completely drained, depleted, while you look at your coworkers and they still seem to have energy? They seem to have breezed through their shift or at least made it a little bit better than you? Well, one of the reasons why could be because they use delegation. Delegation can save you time, it can protect your energy, and it's going to ultimately add to better, safe patient care. Delegation is a skill that can be used in nursing, but also in business. And in this video, we're going to talk about how delegation in nursing can be beneficial as well as delegation in business and how to do it effectively and efficiently. So let's get into it. Perfect, perfect, So in our last video, we talked about delegation, and in this video, we're going to get a little bit deeper. We're going to talk about how to delegate effectively and efficiently. So in nursing, we know that delegation can not only help patient safety, but it can maximize productivity and lead to less burnout. So let's get into the steps to delegating in nursing. So the first step is to assess the patient and the situation. You want to look at the patient complexity, the situation, the acuity, and the stability of the patient. Using your clinical judgment, you will determine for that patient, is this something that you want to delegate based on that patient's current situation? Okay, then we're going to choose the right task. So we're only going to delegate those tasks that are routine, that are non-complex, and don't require critical thinking. So when you think of tasks, think of things like routine things like vital signs, ADLs, giving a patient a bath, transferring a patient, or different things that doesn't require a lot of clinical judgment, doesn't require critical thinking, that can be delegated. Okay. And of course, when you do delegate, you're going to look at the person you're delegating to and make sure that's appropriate. But we're going to get into that. So you want to make sure the task that you are delegating is a routine task, is not complex, and it doesn't require critical thinking. So the next step in effective delegation in nursing is you want to choose the right person. So depending on the task, you want to make sure you're delegating it to the right person. So if I am delegating vital signs, of course, I can delegate that to the CNA, the certified nursing assistant. If I am delegating transferring a patient, maybe they can do that too, the certified nursing assistant. Maybe if it's a task like IV push medications, which in a lot of hospitals, the LPN, the licensed practical nurse, cannot push IV medications, or maybe it's some parts of a patient receiving blood products. You may have to do more with that as the RN or the registered nurse. So you may not be able to delegate certain tasks to the LPN. You definitely have to look at the skill level. You have to think what's legally appropriate. And then you know people that you work with, if you can trust them to do the task appropriately once you have worked with them for a while as well. So look at that too. You want to choose the right person to do the task. In some places they have health techs. So the health techs can draw blood, but the certified nursing assistant does not draw blood. So it just depends on the person, the task, what's legally appropriate, and using your clinical judgment always. Okay, so always look at all the factors, all the things. Okay, the next step would be to communicate clearly. And I cannot emphasize how important this task really is. This is probably a huge task, because if you don't communicate appropriately, you cannot be mad at the person on the back end. You, as the nurse, as the registered nurse, or whoever you're doing the delegation to, you want to make sure that you communicate effectively. So you want to do the whole thing: who, what, when, where, why, how. Okay, who do you want this task done on? You want this done on Mr. Jones? Okay, Mr. Jones. Okay, what do we want done on Mr. Jones? I need his vital signs taken. I gave him some medicine. I need to reassess. I need to know his vital signs or whatever. So Mr. Jones, I need his vital signs taken. Where is Mr. Jones? Mr. Jones is in room 704. I don't know. We're making up a number here. Mr. Jones in room 704. I need his vital signs taken. I need his blood pressure. I need whatever you need to do, get as specific as possible. I need his blood pressure. I need his temperature, whatever vital signs you need. I need a complete set of vital signs on Mr. Jones in room 704. When do I need this by? Okay, I need these vitals by 8 p.m. I need to know what they are. I need you to come back and report it back to me what those vital signs were. Okay, you want to know. I need to know. I need to give him his medicine and I need to know them by this time. And I need you to report back to me as soon as you finish taking them. You want to tell them as specifically as possible. So there is no room for doubt or anything. Communicate that clearly and effectively. Okay. Anything else like that you may need done. If you need that blood sugar check, say they just check their blood sugar and you need a recheck of their blood sugar because you had to give them some Empowered 50. You had to give them some medicine to cause their blood sugar to go back up. Well, you want to know that it was effective. So now you need them to go back again. They'll be like, well, I already took the blood sugar. Well, I need you to do it again. I need you to take it again at this time. I need you to report back to me. I need you to take it on Mr. Jones in room 704. Whatever it is, you need to communicate clearly and effectively, okay? Even when you have them take things to the lab, sometimes you may want a person name. Who did you give it to? I need to know who you gave it to in the lab. I need to know. You're gonna figure it out as you are doing nursing. If you are a new nurse, what you need to say and do. And some people you may need to say more. Some people you may not have to get, well, you may build that trust where you feel like, okay, but you need to be specific because you don't want anything that's not done. It's going to come back to the nurse because you are supposed to be kind of orchestrating this process in the terms of the delegation and everything else. So did you go back and verify? There's a saying called trust but verify. Okay, I done told you, and I want to trust you to do it, but I'm gonna go back and I'm gonna check because it's a saying in nursing called, I'm not gonna say it all completely, but if you know, you know, it's CYA. And you definitely want to CYA and it's cover your basically behind because it's gonna come back to you. You want to protect your license at all times. Okay. So communicate clearly. Very, very important. So the next step is to set the expectations and check the understanding. You want to make sure they understand what to report, and when to escalate. Because even when they take vitals, sometimes they may take vitals and the patient blood pressure might be 182 over 101, or their blood sugar might be 400 or something, or what have you. And you don't want it to be that the nursing assistant doesn't come back and report that to you. So you want to make sure that they know when it is appropriate to escalate. Very important. And make sure they have a clear understanding. They should know, but don't assume that they know. Don't ever assume, but make sure they come back. And if you notice that they've done it once, make sure you correct and intervene as appropriate. So the next step of effective delegation in nursing is to follow up and provide feedback. You definitely want to follow up because once you give a task, what's the point of even giving the task if you're not going to follow up on it? Okay, so you need to follow up and you need to provide feedback. So say if the nursing assistant did a good job, she did exactly what you asked her to do. She came back and she reported the results to you. She did exactly what you asked. So you want to provide feedback. Say, thank you. I appreciate you doing this or what have you, and say, yes, you did exactly right or something. Give some kind of positive reinforcement, some kind of feedback, because everybody needs that sometimes, like it's good to give positive feedback when you've given a delegation task. Okay, also though, you want to provide the feedback when it's maybe not what you wanted kind of response or outcome. So say that they were supposed to go check the vitals, they were supposed to report back to you. They didn't report back to you, but not only did they not report back to you, they did not report back to you and the patient blood pressure was that 182 over 100 and something, right? So it was not reported back and the patient blood pressure was high. So it's not good for patient care or anything, and it's nothing that they didn't follow through. So you want to tell them, hey, I gave you this task, I really needed you to come back and let me know this, because you might have got busy and it might have kind of delayed things, but you're like, man, she never did come back and report this to me. But when you look and check, because you're gonna look and check, you see like, okay, it was high and she didn't come back and tell me. So you want to offer that correction, especially the first time it happens, so you can nip it in the bud and you can address that and make that intervention for the patient. So give positive feedback when it's a good outcome, but also give feedback when it's not the outcome that you wanted, and tell them how they can do this better the next time. So next time, make sure you come back and report the blood pressure to me, whether it's a good blood pressure or whether you don't know or not, or give them parameters. So you may want to tell them if it's above 140 or if it's, above 160, 180, especially if there's parameters where you can give medication. Sometimes the doctor will put PRN or as needed medication in there, where you can give medication if the blood pressure is over 160 or if it's over 180, and depending on the heart rate. So you need to know those things so that you can maybe give that person further direction. Okay, if it's over 180, I need you to come back and tell me so I can intervene. Or if the blood sugar is less than 70, please come back so I can intervene. Let me know. You have to let us know that. That's very critical. And then, follow through. And then, at some point, because this is patient care, you may have to take other steps if this continues to happen. But delegation is there to help all involved. It's going to help that CNA or whatever person you are delegating to own their role and to take hopefully some kind of, I don't like to say pride, but pride in their role and own their role and do a more effective job. And so when they know that they've done a good job, maybe they'll encourage them to do it better. And if they didn't do a great job, maybe they will want to hopefully do better and do that. So yes, definitely provide feedback. So to help you better to effectively delegate in nursing, you can use the 5 rights of delegation, which are the right task, the right circumstance, the right person, the right direction or communication, and the right supervision or evaluation. These will serve as a guide that will help you to effectively delegate and to not cause you to be burnt out at the end of your shift. So we're here talking about delegation in nursing, but also in business. And I do have over 20 years of experience in nursing. In business, I'm starting on the same path with you all. So I am learning about business and I'm sharing what I learned as we go together. So delegation in business. So I have my notes here. So delegation in business allows you to scale. It's going to allow you to avoid that burnout, just like in nursing, but it's also going to allow you to focus on that high value work. Just like we're trying to focus on the tasks that are involve more critical thinking and our clinical judgment in nursing, it's in business, it's going to allow us to focus on that high value work, that work that's going to cause us to get more products, to scale our business and so forth. Okay. So number 1, we want to identify tasks to delegate. Similar in nursing, right? So we want to choose repeatable, time-consuming, non-strategic tasks. So what are those? Like the administrative work, customer support, checking the emails, all of those things that we have to do. We want to make sure that those are tasks that we can delegate. Because when we start off in the beginning, we're doing everything, we're learning everything. And I think that's actually pretty good. If you can learn the tasks before you delegate them, then that way you know if that person don't show up. We know in nursing, especially those on night shift, that when you are at night shift, there may not be a secretary, okay? There may not be somebody to print the labels, to do the other things that the secretary might do. But if you have taken the time to learn how to do those things, when you get that admission and you need a barcode or you need ID band or you need certain things that the secretary normally would do, but you have taken the time to learn how to do them, you can still function and you can do them yourself without the secretary being there. So I think it's a benefit to knowing how to do certain tasks, even if you can delegate those tasks later. So, but the administrative task, that is a task that we can delegate in business. Okay. Those repeatable, time consuming, non-strategic tasks like administrative work, editing, and customer support. We can go ahead and delegate those. Then number 2 is to document the process. Wow. So we want to use standard operating procedures, videos or checklists so tasks can be done without constant oversight. So we can use that to document the process of how things should be done. Okay. So I think that can kind of go with like certain tasks that the person may have to do over and over again. We can kind of streamline that and have it. So just like we get like a job duties statement from our job, like this is what you are expected to do. So with each thing that we delegate, we may have basically a system, a streamlined way okay, these are the tasks that this person in this role has to do or that I need them to do. Okay, so we want to document the process. So say if we were learning in the beginning about how to do a certain task, how we like to edit, or how do we post our videos, or how do we do certain things, then we may document that process in video form, or we may document it on paper form, or what have you, with something to say, okay, this is what I want done. These are the expectations. This is the role that I want you to fulfill. Okay. So then number 3, we have to assign it to the right person. Same way as in nursing, right? So we want to assign the person. We've got to match the skills. So I think when we talk about in business about hiring well, so we want to make sure that we're hiring somebody who actually has the competency and the knowledge to be able to do the skill for which we need, because we don't need anybody who, acting like they know and they don't really know, and then it comes down to it and we made a bad hire. So we don't want to do that. We want to match the skill, personality, and the motivation, because you want somebody who fits within your brand, who fits within what you're trying to do, your mission and your vision. So you want to use contractors, virtual assistants, or hire part-time based on the need. So you want to look at your whole business situation and assign it to the right person. You don't want to make a bad hire. So very much looking at the skill set of the person. Number 4, clearly define expectations. What is the outcome here? What is the timeline? And how should it be delivered? Because sometimes you may hire for just individual tasks, or maybe you have 3 things that you need to get done and you want to just outsource that to someone. So you want to look at what is the outcome. You want them to be then edited these 3 videos. You want them to make these 3 graphics, or you want them to be able to check email and follow through on this deal or whatever it is you have assigned to them. So what is the outcome? What is the timeline? You need this to be done by in 2 weeks. I need it done in 2 weeks on this day at this time. How should it be delivered? Deliver the results to me by email. I need you to send it to me in another way. Whichever way, you need to be very specific about how you want it delivered and what those expectations are. And number 5, we want to give access and tools. So we've got to provide login information to the person, templates, and how do we want it done. So if we are, for example, if the person was hired to do thumbnails or something, and maybe they could use Canva, or maybe they were hired to check the emails, we got to make sure they have access to whatever the email account is. Whatever it is, they got to have the login information, templates, and any resources they'll need to succeed in doing their job. Because if you don't give them the tools, then you can't expect them to do the job for which you're asking them to do. So whatever tools that you have that you're using, make sure they have those. And then you may have just a weekly review, like a debriefing, like how in nursing sometimes we have shift report. We have debriefing if something happened, and we have to have talk about it to see what went wrong, what went well, what can we do better next time, right? So like I said before, in business, you're going to trust but verify. And you're going to allow them to take ownership, but build in systems to track their performance and keep up with what they have been doing, right? So we want to track their performance. We want to make sure that they are taking ownership. We don't want to micromanage. So I think that's important in hiring well and being able to trust the person. So if you know the person, like I said, you've been working with the person in nursing, you've been working with them for a while, you may delegate a task to them because you work with them for maybe 10 years or however long or whatever. You've seen their work ethic, you know how they move, what they do. Okay, I know I can give them a task. There are certain people I work with, I know if I ask them to do something, they're going to do it. They're going to do it without attitude and so forth. And it's going to get done and it's going to get reported back to me. But there have been some people I've worked with in the past that I would not even want to delegate to, because I don't want to compromise patient care. I will not be delegating tasks to people with attitude, pushback, don't follow through. You want to make the best decision. So trust, if you're going to, like, even when you do the task, follow through always, because as the nurse, stuff follow you, and it's your business, it's going to fall on you. You're going to be the CEO, then you have to move and act like a CEO. You don't want to micromanage, but you are supposed to be seeing you should know what's happening in your camp, pretty much. Okay. So The next one would be to celebrate the wins and offer feedback. So acknowledge good work, similar to nursing, give constructive feedback, and keep moving and keep improving the process. So you always want to, if somebody does something well, we all like to hear positive feedback. But if they don't do something well, you got to correct that too, because you don't want it to later hurt your business. You don't want it to later become an even bigger issue because you didn't address it in the beginning. And then you want to keep improving the process. Okay, what can I even do to make this even go even better? Or is there another way? Is there a different tool? Is there something else we can do to improve the process? So yes, there's similarities in both nursing and in business. So it works well for us. Mindset shift for both roles. So we want to, delegation is not, dumping work on each other. Sometimes, it can be very easy to feel like, oh, I don't want to, ask them, like they're gonna feel like I'm bothering them. Sometimes I get that in my head, but like I feel like I'm bothering them, or I gotta ask them to do something. But that's what they're there for. That's what they're hired to do, and that's their. You have to ask, because it's not a one person show. In nursing, it takes everybody in the different roles to help with the patient care. And if you're there for the patient, you shouldn't really mind. It's not a bother. Okay. So delegation is not about dumping work, but it's about empowering others. And I think when we start looking at it like that, it helps us to delegate to the person, and it helps them to own their role and to know that you're a viable part of this and we need you here and we need you to do these tasks and so forth. So empower others and elevate your own role, because you are the registered nurse. You are the person over this for a reason. So use those things, those tools that you have, like delegation, to help you to do your tasks, and use those clinical judgment and critical thinking skills that you need to use elsewhere instead of going to take vitals or take a patient to bathroom. Like, of course you're going to have to do these things, right? Sometimes there's times where you just going to have to do it. Like, so we have to do it all, but when we can and when it's appropriate, delegate, because it's going to help you. So when done right, it's going to build trust, team cohesion, and growth. So that's in nursing and in business. So delegation is super powerful when done right and when used effectively and efficiently. So let me know in the comments, what's one way you're going to start to use delegation in nursing, or if you have your own business, how can you use it in your business to just improve your process so you don't get burnt out and so you can even elevate in your business. So let me know in the comments what you think about this topic on delegation. And I thank you guys so much for joining me today. I will be doing more videos, so you may see the same spiel here, this outfit and everything, but more videos to come. And I thank you guys so much for joining me today here on the Empowered Nursepreneur. That's you. You are empowered to keep going. Thank you guys so much. Don't forget to like, comment, and subscribe. And I'll see you on the next one. Bye.